In 2015, when I moved to the Phoenix area from Colorado Springs, I was being treated by a different doctor. The doctor had increased my medication during one of my visits, and I began to have problems. I couldn't concentrate. I was having my olfactory had increased where I could smell intense odors, and it was really messing with my ability to function. And it got worse and worse. I started hearing noises and all. And I assumed that I was overdosed. So I went back and the doctor wasn't available at the time, so I ended up in the emergency room. It turned out I was overdosed and they had to readjust everything on my pump. At that point I decided I need to find someone else, and I began searching. I called Dr. Castillo's office. Lisa asked me some questions and said, "We'll get back to you, because at this time we're not taking patients." So I get a call back from Kathy, the nurse, and Kathy had an interview with me and discussed my case. Said, "Come in and meet the doctor and see if we can help you." And I was really, really grateful. Being a disabled vet, any help I can get would be a lot better. So when I came in, it was like a family atmosphere. I mean, everybody immediately started to get to know me, and if I felt like I was part of the family. Dr. Castillo did a wonderful job. He immediately looked at it and said, "We've got to get a different pump and do a different placement." His placement is at a higher level, which allows the medication to drip into my spine much easier, get to the affected area in my spine. So we began the process of, first we had surgery on December 23rd of 2015, removed the previous pump and put in a new, and then we adjusted the pump as we went. Under Dr. Castillo's care since 2015, which is over 5 years now, I have been fortunate enough to have my medication decreased at least 50% compared to what it was when I first came to Dr. Castillo, which is immensely very, very good for me as far as the medication input goes, as well as controlling my pain. The reason I am on a pump, and I'm an advocate for pump therapy, is I was being treated by numerous medical facilities for my spine pain, and the medication I was receiving was purely opiates. I was taking oral opiates continuously. I was on 4 or 5 different types of opiates, as well as muscle relaxers and barbiturates. I mean, I was a drug addict. I worked for the United States Air Force as a contractor. I was the lead on designing satellites for the U.S. Air Force, and I just was unable to perform my job because of the medication I was on. I was falling asleep. I wasn't able to concentrate. When you're leading a group of 50 people, that's not a good thing. So my wife heard of a pump where they put the medicine into your spine. It's not supposed to interfere with your mental processing. In other words, you wouldn't be in a fog all the time. So I immediately started searching, as my wife did, and we found a doctor that was willing to take me on. Now, this was in Colorado before I moved to Phoenix, Arizona. But the pump, once I got on the pump, we weaned me off the medication, and I'm just now, I am just using the pump for pain therapy now. And my pain has gone from sitting in a wheelchair and unable to move to being able to actually go to the gym again, lost 55 pounds. I play golf, I work out. Although I still have back pain, it's tolerable pain. I can function in my life. And no, not at 100%. You'll never be 100% again if you have major surgeries like I've had. You have to accept that, but the pump can augment that and control that pain and keep you at a place where at least you can function in your life. Instead of sitting in a wheelchair or sitting at home or using a cane, I don't have to do any of that anymore. I just am able to limit what I can do. I mean, I still can't walk far, obviously, but I can at least walk, and it's just short distances. I can stand again without assistance of a cane or having to hold on to things, and I can actually enjoy my life again. As far as pump therapy, I recommend it to anybody that's having severe pain. Again, the bottom line is you're not going to get rid of all your pain, but if you can get rid of 80% of it, even 50%, it's better than what you're dealing with now. Plus, there is no fog as you experience when you're doing opioids. That's the big thing for me, is I can actually function and enjoy myself. Plus, I know that I'm not destroying my organs by taking all of the opioids. And with the opioid crisis that we're going through, this definitely is completely different, because you do not get a buzz, if you will, when you have a pump, because the medicine goes right into the area affected in your spinal cord and controls the pain that way, versus orally when your body processes it, going through your organs, of course destroying your organs and causing other problems down the road.